Hey, this is Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about what happens when your attachments to your aligners break. And what is an attachment? An attachment are these little things right here. Here's 1, 2, 3, 4, 5, 6. So they're little handles that are bonded onto the teeth to help more efficiently and accurately rotate teeth or extrude teeth, pull them down. If you have a higher tooth, you're trying to level them. So that's up and down movements or rotation movements. So especially teeth, especially these lateral teeth or even these bicuspids here, these are round, these are flat, they don't move as efficiently without a handle. Some other teeth will, but some don't. Or if the tooth is really rotated, it'll move better and faster with a handle or an attachment. Okay, so now you know. Why do some types of aligners have lots of attachments and some have no attachments? Well, that's a great question. Certain brands of aligners have a very scallop trim like this, okay, and those are going to need more attachments. It also depends for retention so that it can stay in the mouth and doesn't fall out when you eat and talk. Other brands have a higher trim line and those don't need as many or any attachments. It's just fundamental physics is all it is in design. And you can look at my other videos on the benefits of certain types of trim lines. I have a video about that. You can just look in my site and look up trim or trim line, and it should come up. And we talk about the scientific basis of different trim lines and why you might choose one and why you might choose another. Certain brands have a very scalloped trim line, some have a high trim line, some have a trim line right in between. And ultimately, you need to decide which one is best for you. Also, the other factor that's involved in attachments is the consistency or the biomaterial that makes up the thermoplastic material. So what type of plastic are they using? There's some types of plastics that are used that are more flexible, and they kind of have an elastomeric nature. Those ones might need more attachments to hold them in because, again, we don't have that rigidity that we have in other ones. And other ones are more thick or rigid, and those will need less attachments. So the nice thing about the more flexible material is generally has a lower modulus of force or lower force points per tooth, so that it's a little more comfortable, less discomfort for the patient, and also lower forces is healthier for the teeth. So that's a nice thing about this one. So, you know, with everything, there's risks, benefits, and alternatives. So you need to make a choice which system is right for you. But anyways, I didn't answer the question, what happens when your attachment breaks? So I'm going to answer this for patients, and then I'm going to answer this for doctors because both listen to my videos. So let's start with patients first. If your attachment breaks, first of all, good for you for noticing that it broke. I always recommend that my patients count their attachments regularly, know how many they have. Do they have 15? Do they have 16? Do they have 7 uppers, 3 lowers? You know, and make sure they're there regularly because they can come off and you won't even notice sometimes. If you don't notice that they came off, then your treatment's probably going to go off track, you know? So it's not like a total nightmare. A lot of doctors are doing cases that have unlimited tweaks and refinements, so it's just a slight inconvenience for both doctor and patient, but not a huge deal. But in other systems, you might have one where it's going to cost you money if something like this happens. So it's better to, regardless, it's better to let your doctor know as soon as it happens. For the most part, for my patients, I tell them to stay where they are in that aligner and not to continue advancing in their aligner sequence until they can come back, and we'll put it back on. So that's basically how that works. Now, for the most part, to put it back on, you're going to need to order a new attachment template. Now I'm talking to the doctors. So attachment templates are the more flexible version of the aligner so that you can put the attachments on and peel it off, right? So normally we do the attachment template at stage 0, which is at delivery. So you only get one in your pack. It's probably impossible. Maybe you could use an old aligner as an attachment template. That's another option, but it'll likely lock in there, and maybe it could lock in there. It's going to be a little harder to get it off after you bond, especially if there's flash. So you might have to cut it or drill it off. That's the only thing. So that might work too. You could try that. But if somehow it didn't go on just right, you're kind of screwed. You're going to have to take them all off and do it all over again. The other option is to contact whoever is your manufacturer for your aligners and ask for an attachment template to be made off X, whatever aligner you're on. So if the attachment broke on aligner 6, then patient stays in aligner 6, patient calls doctor, doctor can do one of two things. Either doctor can use aligner 5 or aligner 6 as an attachment template, knowing that it very well might lock in and they might have to cut it off. So then they'd have to go to 7, right? So you lose that one. So it's a little bit risk in there if things don't work out just right. Or doctor can call the manufacturer and ask for a new aligner template to be made, attachment template to be made off aligner 6. Patient stays in 6, definitely does not advance to 7. And they will ship it to you. Usually there's a small fee for that, and I totally can't remember what Invisalign and ClearCorrect charge. It might be like $30, $20, $10, I don't know. It's pretty nominal. I'm thinking it's $10 for comprehensive, and it might be more for other systems. And I think ClearCorrect might be $30, but sometimes they give them for free. So I think you just ultimately want to give your manufacturing company a call to find out how much it costs. I know with Invisalign you can just order it right from the portal. You just click additional aligners and say that you want an attachment template. And I actually have a video about that. If you want to message me, I can show you the how-to video on how to do that. But yeah, I mean, that's what I would do. I realize it's a little bit inconvenient because that's going to take probably 2 to 3 weeks to get it. I'm just guessing, maybe less. So the patient will have to stay in aligner number 6 for a couple of weeks until they can get it fixed, and then they can move on to 7. A little bit inconvenient, a little bit gross, but it's going to be way more accurate to do it that way than to do it the other way. So that's the way I prefer. But anyways, so patients, just, that's good that you're aware. Keep your eye on your attachments. It happens, things break. All right, thanks so much.